Hi, Shelley. Welcome back to the Brush with Britt podcast.
Hello, and thank you for having me back again. Round two.
Thank you. Thank you for coming back so soon. I mean, there's so many things that I could talk to you about. And today I really wanted to focus on silver diamine fluoride, which I have seen online. I've seen it as an RDA when I was assisting. I saw it in pediatric practices, but I feel like I kind of don't see it very much in clinical practice in the offices that I've been in. So I would love if you can just inform us of what silver diamine fluoride is.
Yeah. Ooh, brush with Britt. Where do we begin? uh, well, I guess should we start with let's just start with what it is. I guess we could say so. There's actually a few different kinds. You said the word silver diamine fluoride. That's like the traditional one that we usually think about when we're thinking about these silver fluorides, but there's actually a few different types out there. There's a few brands that have a silver diamine fluoride, like a one step. So now there's about 3 brands out there that have this one step application, and it has silver in it to repel microbes. It has ammonia in it, which is like the diamine part. And then it has fluoride, which helps to remineralize the teeth, right? There's also another version that they have a second step of potassium iodide that can pull out some of the staining that we traditionally like see with silver fluorides. I don't see a whole lot of offices using that and doing that second step because they find that it stains anyway. So it's like, why do the extra step? And then there's a new one on the market. And it's called a nano silver sodium fluoride. It's different from the diamine fluoride. And there's only one product currently in America that has the nano silver fluoride in it. So there's a few differentiations. Those are the few types that are out there and available to us.
And what do they do?
There's a few indications when you go get approval through the FDA. I feel like everything in dentistry has to get like a sensitivity relief. They don't have like a we can arrest caries because then there's a few other steps you have to do to become a drug, and there's a lot of details FDA wise that I don't really know much about it. So we see a lot of these products used on label as sensitivity treatments, but most are using them off label for caries arrest to stop cavities in their tracks and then to also harden those cavities at the same time. As the clinician, we're like, oh, like, should we only be using it for sensitivity? Because that's what it's on label for. Like, you kind of have to decide as a clinician, like, do I want to use it off label for all of these great things that it does? So I think that that's one of the hindrances why people maybe don't use it because they just see, oh, it's for sensitivity only. But there is this amazing amount of research that shows that silver diamine fluorides do remineralize. We have a lot more data on the silver diamine fluorides than we do on the nano sodium silver fluorides because it's a pretty new product. So that's what they do essentially is they stop cavities in their tracks. And who doesn't want that, right?
Yeah, everybody wants that. How is this different from like a fluoride varnish though? Because it has the word fluoride in there, so I feel like that can be a little confusing.
Our fluoride varnishes, they have, a really high dose of fluoride in them that help to remineralize all the teeth, right? Our silver diamine fluorides, they are used locally on one particular area. We wouldn't just want to like bathe all the teeth in these by any means. So that's why they're a little bit different. But one really cool thing, there was this study that was done that showed that even if you had one tooth that you placed a silver diamine fluoride on, either preventively or to arrest caries, that it will arrest caries like at the same rate as a fluoride varnish. Isn't that cool? I'm just going to kind of clump them all together into one because it's hard to talk sometimes specifically about each individual one. Is that they can also, I told you that they will arrest caries, right? Like you can paint it on and it will stop caries in its tracks, but it will also prevent caries from occurring. So as I just mentioned to you, like if you place it on one area, it can act kind of like prevention rates of a varnish, but we could use it preventively. So there was this really interesting study that was done on 3,000 kiddos in New York. And this particular silver fluoride that was studied was the one from Advantage Arrest from Elevate Oral Care. And they tested it against sealants. Okay, could we paint this on preventively and prevent it at similar rates to caries? So there's not even a cavity there. We're just like, let's paint it on preventively. And it prevented caries at like 82%, and sealants, it was like 84%. So it's faster to place, much cheaper than a sealant, and you can place it on the teeth preventively. And I do want to note that when you place it on the tooth preventively, it does not stain. If it's sound tooth structure, I should say. There are some times where I place it though, and you didn't know it was demineralized even at an early level, and it does darken a little bit. So you always have to be cautious and tell your patient this could potentially happen if we're painting on the occlusal surfaces. But think about that from a prevention standpoint. Could we catch teeth at eruption when we know there's not, a caries starting? Sometimes there is, but in extreme cases. But could we catch it earlier when it hasn't erupted? Maybe it's a little bit under the operculum even, and paint a silver fluoride on that occlusal surface so that it does not get a cavity. And we could still do a sealant if we wanted later on, but preventively, wouldn't that be so exciting to be able to do stuff like that?
So you're saying you would be able to apply it kind of similarly to a sealant. It's a little bit different. It wouldn't necessarily like fill up the grooves a way a sealant does, but
Mm-hmm.
it would basically stop any caries from starting.
Exactly. And let me tell you a little bit how it does that, right? Because you're like, wait, Shelley, there's nothing occluding the groove like a sealant does, right? So what happens is it has that silver aspect in it, right? And the silver, these are little cations that microbes do not like. You've probably heard a lot about silver in the medical world, and you're like, okay, silver's like an antimicrobial. So the silver goes down into our microscopic dentinal tubules, and it hangs out there with the fluoride. And then when a bacteria comes along, kind of has this little zombie effect to it, they call it. As it gets close to the silver that's in the tubule, the silver interacts with the microbes and kills the microbes. So it's like continually working in there. And if you can think of it this way too, like if a strep mutant comes along, right? That's the big bad dog who's causing caries. If it comes along and it gets close to that silver that's down in those tubules, it destroys the strep mutans. And if that cannot build up a biofilm and release the acids on that tooth, then it won't destroy the tooth. Plus the fluoride is in there also remineralizing at the same time. So this is not a one and done thing too, by the way. Like you have to, I place it. I mean, I place it probably more often because I'm in mobile dentistry, but like in a traditional practice, if you're like, okay, we're going to place your silver fluoride on your occlusal surfaces once a year to prevent caries, like how easy is that? Because it's super cheap, Britt. It's like $1 a drop, and one drop can treat 5 teeth. So like compared
Wow.
to a sealant, so like if you're just sweeping it on some of those occlusal surfaces, I mean, I'm talking about occlusal surfaces right now, but there's some other
Yeah.
applications for it that we can talk about later. How awesome would it be? And then also in the medical world, they have a new code that they can place silver diamine fluoride as well. So they don't really know quite yet how to use it. There's a few places introducing it. That would be quite the dream. That's why we, of course, need to work for autonomy as dental hygienists so that we can be in these pediatric practices placing silver fluorides on these little ones. But can you imagine, like, they get their vaccine checkup. We can see if their first tooth is coming in. We can paint it preventively on any tooth structure to prevent caries. It should be in every pediatric office. It should be in every school. Like we can prevent caries in these little ones way early on. There's just like so many avenues we could be using it.
Oh my gosh, I want to do that so bad. I'm like hearing this, I'm like, that's amazing. Cause I mean, sealants is great, but there also, there are some things with it where sometimes that bacteria can get trapped underneath it if it's not like completely clean. So I loved when you said like you could potentially do like one and then like a sealant too, and at
Mm-hmm.
some point. I love that. That's amazing. So what are some of the other areas that you can use this?
In my opinion, every kiddo age 0 to 3, when they get a new tooth in, it should be fortified in those high risk areas. So like think baby bottle decay, think occlusal surfaces as they're coming in. even interproximally. It can be flossed interproximally. So you like put it in between the teeth, put floss in between the teeth, put a little piece of the silver fluoride on the end of the floss and kind of pull it interproximally. There are some clinicians who get a more viscous one, a little more runny, because there's some gels out there. Elevate Oral Care is the only one that makes a gel. But there's one that most of them are a little bit more runny, and you can just touch it on the contact on the occlusal surface and it flows. Like it goes places. Maybe sometimes you don't always want it to, but it will flow interproximally. So little kiddos age 2 to 6. I mean, have you seen kiddos come in and their teeth are just bombed out? Usually parents don't bring them in till they're 3. And by that time it's too late. So that's why we're trying to catch them earlier in some of these other medical offices. Any occlusal surfaces of new permanent molars should have it on. You see this 12-year-old molar erupting in, and you're like, let's put some silver fluoride on that. So just preventively, to repel the biofilm so it doesn't build up and cause caries. Any exposed root surface of older adults as well. And probably should be done yearly. In my patients in mobile dentistry, I'm doing it more often because most of my patients are non-ambulatory. They cannot walk. They don't respond. I'm jumping up into their bed to provide treatment for them. My goal is to keep them cavity free. When I first started, I was doing a fluoride varnish, like you, Britt. I was like, I'm just gonna do a fluoride varnish. I'm gonna call it good. And then I was like, oh my gosh, these patients literally, like, they need to see a dentist. I would need to bring a dentist here if we have something, right? Because they cannot go to an office. But I was like, how do I honestly keep my patients cavity free? So then I started doing a little bit of a deeper dive, and I was like, oh, these silver fluorides are amazing. And P11,4 peptides and, povidone iodine and things like that to keep my patients cavity free. And I don't think I expected to dive into caries as much as I have because of mobile dentistry. I was, focused on prophies, the whole prophy, preventive therapies and instrumentation. And then I realized like there's this whole other aspect to our appointments that we could have of remineralization. So like, let's catch these things sooner. Let's remineralize it. Let's do a remineralization appointment and then maybe a restoration appointment. Like there's preventive prophylaxis and then a remineralization appointment, and then let's have you see a restorative. So if we can add in more of this remineralization with silver fluorides and some of these other cool products, that's going to save more teeth. So
Absolutely. I know you mentioned placing it around recession areas and things like that. I see a lot of geriatric patients, and the root exposure you see rampant root decay just happens so quickly. So when you are doing that, what has your experience been when placing it along areas of recession? Have you had like some incidences where it's just like all of a sudden you see like caries all over?
not when you use it, on root surfaces, obviously you have to get consent because it could turn dark. So if you see caries, I think this was maybe your question. If you see caries, you could definitely place it on there, but a dentist might still be like, hey, we're still going to feel that. You know what I mean? It still might need a filling. So obviously you have to be talking with your dentist. But preventively, you could place it on and fortify that root surface so then it does not get caries. And think about like a crown too. Like how often have you seen a class 5, like right along that margin, it gets caries so easily. So I'm also placing it around the margins of all crowns preventively. It's so cost effective. And if you do several throughout the appointment for 10 or 20 or $30, $40, depending on how much your office wants to charge for it. I heard of one office charging 80. I feel like that's a little bit much, but just because it's so inexpensive, depending on which kind you buy. But yeah, placing it on those root surfaces, getting consent, and just letting them know it might brown just a little bit. If you don't like it, we can always drill it out and put a white filling in there. And that's where maybe a nano silver fluoride you might like that more, because a silver diamine fluoride will stain the teeth. It will cause that stain to occur, and that's just the oxidization of the silver in the material. But a nano silver fluoride is kind of newer on the market. There's only one company who's selling it right now. If they're concerned about that stain, you could definitely try that one. It works a little bit different than a diamine fluoride. I don't feel like it's quite as strong. It definitely works on sensitivity. I'm kind of like, does it arrest caries as well? We don't quite have enough data on like the nano silver fluoride, but if your patient is concerned about that stain, you could definitely try placing that on. In my mobile practice, I am using it on my geriatric patients on the cosmetic zones, is what they say. So, like on all their front recession, instead of using a silver diamine fluoride, I'm using the nano silver fluoride. So there's a few different options for you when it comes to placing it on root surfaces.
Have you seen it help with sensitivity?
Oh, 100%. 100%. Yes. But it,
Probably.
it definitely needs, like, it's not a one and done forever. It might need a second dose. So they do say with any silver diamine fluoride that you place, like me, I'm going in probably 1 or 2 weeks later and doing a second dose of everything. And mainly that's because, like, with a first dose preventively, you get that 70% or 80-ish percent like prevention rate. But if you do a second dose, it's like 90 to 95%. So, like, if you do that first initial one and then you bring it back in 2 weeks later, you place it again, and then placing it maybe every 6 months, depending on their caries risk, or maybe every year, depending on their caries risk or how things are looking. But kind of the cool magical thing about a silver fluoride. So I had this one patient, she needed her teeth extracted for sure. She had a stroke, she couldn't get out of bed well, it was hard to get her there. So I was like, well, in the meantime, let's paint this silver fluoride on there and let's see what happens on all of her root surfaces. And you could just see it, like, while I was placing it, kind of turn dark. And then it probably takes a full 24 hours for it to fully darken. But I came back 2 weeks later and, she'd had a stroke, so she couldn't brush well in the first place. So they were initially covered in biofilm and they were sticky. They're that sticky caries feeling. But I came back 2 weeks later and those teeth were hard. They harden 3 times as hard. Maybe it's not three, it's twice as hard is what it is, as what dentin once was. So it's not that sticky leathery anymore. It hardens the tooth structure. And even she couldn't brush her teeth still, but the biofilm was not there because that silver was repelling the biofilm. Guess what also looked really great was her gingiva. So this is not really something that we do all the time, placing silver fluoride down in the gingiva by any means, but there was this one cool study that was done where they took silver fluorides and they placed it in the gingiva only on this patient who had lots of calculus and super inflamed gums, and they didn't do any cleaning. So, like, sometimes my patients can't have a cleaning, if they're punching me or biting me or whatever it might be. So I'm like, well, let's just paint this liquid on, because it's going to repel the biofilm and help with the gingivitis and the inflammation and destroy the bacteria that's in the area. So this particular patient, her tooth surface was hardened, desensitized because she was in a lot of pain and sensitivity. And then her gingiva looked so good because the biofilm was being repelled as well. So kind of I don't use it a whole lot in those instances, but if I have a patient who really can't brush well in an area and I'm doing silver fluoride there to remineralize their tooth, like along the margin, I'm like, ooh, I know this is also going to help your gums at the same time. So that's kind of an interesting use, but not a lot that is like promoted, but a little industry secret, you could say.
Wow, all of that stuff is so exciting. I feel like it's kind of something I haven't been utilizing, and I can think of so many patients where I'm like, "Oh, I should have put it on that. I should have put it on that." Like, it
Hmm.
sounds really, really great, and I love it as a tool for prevention too. Um, all the great things about it. Are there any contraindications, any risks for using it?
Yeah, if your patient has a known like silver allergy, which I've not, it's pretty rare, you wouldn't want to use it. If they have an ulcerative gingivitis, so if they had like a necrotizing condition in their mouth, and you're like, oh, let's paint silver fluoride, that's probably not. It's gonna be painful, so I wouldn't do that. If they have any pulpal involvement, so if there is an abscess, you don't want to get that silver down into the pulp chamber. That's going to cause a lot more pain and pulpal inflammation. Yeah, if it's super deep caries, you could risk pulpal exposure, but some dental dentists are using it as like to stimulate tertiary dentin growth. So if you have a really deep cavity that's not quite to the nerve and you want to decrease some of that sensitivity before you place a filling, then they'll go ahead and place that and it will regenerate that dentin, that tertiary dentin. Remember learning that back clear from
Yeah.
embryology. So that's kind of an interesting use. I mean, another cool thing along with that, let's say your dentist recommends a filling on a patient. You're like, yeah, I can see that, right? Your patient's going to come back in a few weeks to get it filled. I would recommend talking to the dentist and seeing if this is something that you could do, because if you pull the day that you see caries is the day you should arrest caries. Okay, we shouldn't like be leaving caries in a patient's mouth to be walking around. Like if you see it, you're the dental professional. Who knows when we're going to see them again? Like let's stop that caries in its track. Same day with the little silver fluoride. Like drop it in the dropper, get the little thingy, you dry the tooth, you let it sit there for 1 minute, and then you're done. Your patient can go. Okay, they can eat and drink right away. It is best if you can follow it up with a little fluoride varnish afterwards. They do say that that kind of seals everything in. And they have individual drops of those if you're doing one spot. But man, arresting the caries the same day your dentist diagnoses it, it will reduce their sensitivity in between their next visit. Because, have you ever eaten a little candy bar when you have a cavity? It does not feel good because there's, demineralization there. After they get the filling done, there's going to be less operative sensitivity because you place that silver diamine fluoride. It will build that secondary dentin in between, so don't have to take away as much tooth structure. And then it also reduces the chances for secondary decay, recurrent decay. So you're fortifying that restoration for longer, right? When that doesn't every patient want that? There is a technique though to placing it. You wouldn't want to place it same day. Is what I'm trying to
That's what
say.
I was gonna ask.
Some clinicians, the dentist would do it same day, and then they put the restoration over it, and it would turn the whole tooth kind of a darky gray color. So there is something about the light cure. I'm not totally well versed in the restorative section. Hopefully, I will be soon because we can place restoration soon here in Utah. But there's something about light curing it before or waiting a few days in between so that does not happen. Once you get down to solid tooth structure and you've placed silver fluoride there and it's hardened, don't take away more tooth structure. Just leave it there and let it continue to work and prevent recurrent caries. Because that's the life cycle of caries, right? Like you think that filling is going to be good there forever. They have a shelf life, right? They have a shelf life of maybe 10, 15 years. And then we're needing to take that out and take out more tooth structure. Like the goal is to never have to drill. But the goal really is prevention. And so this becomes a huge tool for us as dental providers to use for our patients preventively in a lot of different ways.
Can hygienists in most states apply this? Is it within their scope?
Yes, it definitely is. And even assistants too could place it. So if you had an assistant in hygiene, you can train them and they can place it. There are some states where you have to go to extra coursework to be able to place silver fluorides, which I think is super outdated these days, mainly because the medical world can place it. Like a doctor could tell their nurse assistant without any training, go place a silver fluoride. So I feel like we limit ourselves quite a bit in dentistry. We are in our own way sometimes for prevention, which feels really frustrating. I'm like, just let us prevent already. Like we are the trained, ready people to do that, and we are in our own way. So I would encourage your state, if that is you. I mean, you could require some CE on it, but if it's like an extra training, you're preventing clinicians from being able to do their work they need to do. So that's very few states. I don't even know which state it is, but that's just what I've heard.
I know that you're in mobile dentistry, and that's where you're using it more of like public health type settings. Do you also feel that this should be used in all dental practices?
Oh, 100%. And I think our biggest fear is the stain, right? We're like, ooh, it's going to stain the tooth. It's going to stain our equipment. Because if you're not, all of you who have ever used it or will start to use it will get a little accidental stain. The very first time I used it, I accidentally dripped it on the patient's face and they got this like freckle. And I was like, oh, it comes off easily with hydrogen peroxide, but it doesn't show up for like 3 hours later. So they get home and they're like, mom's trying to peel this off their face. And they're like, what's happening? So that's where consent comes in. So we've not wanted to do it because of the stain. So you have to have really great protocols to be able to place it in the practice. But I don't want you to be too fearful of that. Like if I always like put it out and then I just know I've gotten some of my gloves. I always just assume. So I get new gloves on and then I'm really careful not to touch everything. And even in cleanup, I'm like containing everything because I don't want it to stain all my equipment. So you just like anything else, you have to follow the protocols and don't let that stain be too fearful for you. When you're training people, just make sure they're really aware of that. Does it work? I feel like there was some earlier studies that was like, it only works 50% of the time. Yeah. And the deeper you go in a carious lesion, the less it's going to work. And the maybe more follow-ups you have to do on those patients, the more you have to see them. So and remembering it's not a one and done thing. We're just like, oh, we want to place it on and it's good forever. I think we have to remember its limitations. But I just think preventively, like it is a great tool for prevention, 100% that we should incorporate more into our practice. And I think too, hygienists are a little bit afraid to do it. We're just like in the prophy zone. We forget about this whole caries aspect that we could help prevent because we're like, we're limited to an hour. I can't do anything else beyond that. But man, if you start like it would take a huge shift too to be like, okay, I'm going to start bringing patients back for a remineralization appointment. I'm going to do some blue check and find areas that are, all these watches, any watches that when a dentist says that word watch, that means I'm going to treat. We're not just going to watch anything anymore. I'm going to treat. But so it takes a whole shift because we're doing extra things in our operatory and we feel limited already on time. So I think there's, a few of those barriers, but if you really want to make a difference in your patients and your practice, like come up with an idea and be like, this is how I can incorporate this. This is how I want to maybe start with these few areas. Like maybe you decide I don't want to risk like it staining a root surface. Maybe you decide on all teens, I'm going to floss this interproximally because they are eating soda and they are eating candy and they are not taking great care of their teeth. Maybe I'm going to start by just flossing it, doing a protocol where I floss it between all their teeth, and then I'm doing it on all root surfaces. So maybe you could start there and then just be like, this is automatically what we do. I want the dentist to come in. The dentist has to diagnose it because of the laws of the land we live in, depending on your setting. They have to diagnose it if you're doing it, for anything other than hypersensitivity type thing. And then, get your dentist on board and do more prevention. And at the same time, it helps increase your production, right? And if your schedule is not full, I had this one hygienist, one of my students, she's like, Miss Brown, they're going to hire me, but the schedule's not full. And I was like, you know exactly what to do, right? Like you make a little bit extra 20 minutes in your appointment that aren't full and you do lots of remineralization. Let's bring in your silver fluorides. Let's bring in your curodonts. Like if you see an incipient lesion, that's when you're doing a curodont, which is a P11,4 peptide. It costs a little bit more money and takes a little more time to place, but great on those white spot lesions. Silver fluorides I like to use even earlier for prevention, but come up with a protocol and really change the face of prevention in your practice.
I don't think we mentioned how to apply it, what that
Yeah.
process is like.
Yeah. So you just make sure the tooth is clear of debris and, dry it off. A lot of times I'm just doing that with a gauze even. You could do it with a gauze or your air water. And then you place it on, saturate the area and let it sit for 1 minute. And then you can leave it at that. You can even rinse it right afterwards. There was one study, Elevate Oral Care, they just sent me that said you can like eat and drink afterwards. No big deal. It's not going to affect it. But if you want a tiny bit more remineralization, maybe a 1 to 5-ish%, then you can place your a fluoride varnish on right after. And there's fluoride varnishes out there that, of course, do the full mouth. but they also have ones that come in a little drop, and you could just do that locally. You can get a little drop out and just use a tiny little bit of varnish in that one area if your patient's like, I don't want to do varnish on my whole mouth or whatever it might be.
Is there any taste to it?
Ooh, yes, it tastes silvery. It tastes It has a
Really?
bitter taste, yeah, and I didn't think that the nano silver tasted quite as much, but then I have some people say, "Ooh, that's a little bit bitter," but the silver, the ammonia in it does make it have a little bit of a bitter taste, so that's another nice thing about a fluoride varnish afterwards. I mean, those don't taste great either, but it helps with that taste a little bit too. Or in a kiddo, if you're like, you don't do the fluoride varnish, you can give them a xylitol sucker. Like,
Do you have anything else that you wanna share about SDF?
yeah, I will say that coverage is getting a little bit better insurance-wise too. So some patients have been paying for this out of pocket, so people might wanna know a little bit about that. There's a few different codes for it. There's like a sensitivity code or carries a risk code. So you just wanna do the procedure code that you're, using it for. That's the code that you'll wanna use. And the companies who sell these, they always have like continuing education programs about them. And so I would recommend you sit down with your dentist and be like, I want to build like a whole remineralization program in this office. I don't want patients to get cavities. No offense. I know you want to drill. There's still going to be a lot of that. Anybody who's listening to this and is like, oh, they're going to take away our ability to do a crown or filling. I mean, I hope so a little bit, but I also there's still gonna be lots of work to do. Like, our disease is rampant, right? So it's gonna be pretty crazy. So yeah, it's kind of being covered more and more by insurance. The more we use it in dentistry, the more it will be covered. But a lot of times patients are paying for this out of pocket. And I think having both options in the practice is important. So like a nano silver non-staining and the silver diamine fluorides, which we have a lot of evidence on how those ones work. So we could trust that that's gonna prevent caries and things like that. Your patient might be like, "Oh, I don't want it to stain." Then you could be like, "Well, you could try this option, but if it doesn't work and we are still, let's bring you back and we still see, that the tissue is red around the area and we still see biofilm there, then we gotta go with this other one." Because we know that it's gonna repel that the biofilm and it's gonna really harden that tooth structure and really strengthen it. So you could have a few options out there. You just kind of have to set your protocols as to what you really feel like is going to truly prevent caries for these patients. And I feel like that conversation on stain on back teeth, most patients are like, okay.
Yeah.
Like they don't.
Yeah. Yeah.
I've never
I
had a
agree, I
patient be like,
agree.
kiddos and moms, like if it's a front tooth, it's already,
Yes.
if it's started already and it's white, they're not, a white spot lesion is going to turn black. So that's a time for a nano silver fluoride and maybe bring them in every month to do something like that because, they're at really high risk for that tooth cavitating, so maybe your protocol for that particular kiddo is going to be a little bit different. But most of the time, if it's a carious lesion, it's like it's already dark. This might darken it a tiny little bit more, just a heads up, but you won't notice really a difference. There's patients now who are seeking this treatment out. They have a website where there's doctors who can sign up and be like, I'm a doctor who does silver diamine fluoride. Because there's patients who are seeking it out because they want earlier treatment of their carious lesions, and especially kiddos. I mean, kiddos, 100%, like they're sedating kids so, so much these days. There was a little kiddo who just died recently from complications from sedation. Obviously, there's a time and place for that. If there's abscesses and we need extractions, like 100%. But if there's just rampant caries with no abscesses, I mean, if it were my kid, I'd be like, silver fluoride. Let's silver fluoride these things, initial dose, 2 weeks, every month until we feel like they're pretty arrested. And then every 6 months to 1 year until these teeth fall out. I'm always a little leery about sedation, and some parents are too. Like there's a time and place for that. Obviously, talk with your providers if that's you and you're listening to this. But there's another awesome option. Like if you have a wiggly kid in the chair who's just screaming and doesn't want a shot, like why not silver fluoride? Should be a really great option. I mean, it would be the same for adults too. I think too often, Britt, we've been like, oh, peds and Jerry for this product because, oh, the Jerry's too, they might not need that tooth that long, or these pediatric teeth are going to fall out. But man, I would give anything if somebody had placed silver fluoride on my teeth as a teen before I knew what was going on in the world and prevented my teeth from getting cavities. These beautiful, fresh teeth, you know? Like,
And
I
now I'm
just
I'm
feel like
sitting
we
here
have a
thinking
big
like,
play.
"Wait, I think I need to put this on my teeth right now." That's what I'm thinking. I'm like,
Come
"I
to
need to go
Utah
put this on some of my molars."
and let's put it on some of your molars. 100%.
Yes,
I
yes,
think
that's
anybody high
exactly.
cavity risk definitely needs some fortification and prevention.
So have you seen it in, like, an interproximal area that's like a watch area, how you mentioned, and then you floss it in between the teeth? Have you, gone through that experience and, like, done that and seen, like, any changes or anything?
Yeah, you won't it's so hard to see on a radiograph interproximally, see changes like that. What you would see is no progression. So it'll probably always stay a little dark on a radiograph, but hopefully you can keep it in that enamel surface and not crossing that DEJ. Once it crosses into the DEJ, you're probably going to need a little more definitive care. The dentist will, decide that, but if it's just into that early enamel area, this would be a really great option. And it's cheaper than there's also Curodont. If I don't mention that, I feel like I would be doing a disservice. Curodont is a P11,4 peptide that helps regenerate enamel. So if you have a watch in between the teeth, Curodont rebuilds enamel through calcium and phosphate, and it does it a little bit better than a silver fluoride, a little bit higher rates. And it's a one and done on that one. It doesn't have to be reapplied. And it can obviously you want to check it every time. Some are seeing some changes on the radiograph mineralization with that one, but it's not going to be 100% to where it once was. So I think the evidence in knowing is this working or not is hopefully we don't see progression. There needs to be a better tool out there for us. Somebody needs to invent this where we can know if something's been arrested interproximally. I can do that on the facial surfaces with like a blue check where it's at that dye that goes in and tells you if the tooth is mineralized or not. You can do that with those products, but interproximally, I'm just doing my best guess, and I lean towards let's place it again because you're
Yeah.
still, it kind of wears off a little bit over time. You could say the particles come out of the tooth, and we want to put more in to keep you cavity free.
Well, it still sounds like a really, really great product in so many ways. And like you can use it for all age ranges in different types of settings. And it's overall a really good idea to start using it as a prevention service, which I wanted to ask, when did it come out? Because I remember being an RDA and seeing it used in a pediatric office around like, I want to say like 2018 or something like that.
Yeah, around that time it first came to America, but they've been using it in Japan, I think it is, for many, many years before that, and they just were barely bringing it to the America. It's just barely hit the textbooks. Not a lot of schools have been doing it, and that's why when we don't learn something in school, sometimes we're like, not doing it. But that's why we do CE, and that's why we always continue to grow and advance our profession. So just barely hit the textbooks, just barely starting to hit boards. So students are learning more and more about it. So yeah, it's really only been around for 10 or 15 years here available to us. And we're seeing more and more product of it coming out. There was a new one just released by PacDent. There's one by Centrix. There's the one by Young, Rivastar, and then Advantage Arrest are the ones that are currently available to us here to use. So there's a lot of options.
Any last advice for a hygienist that wants to start to learn more about this in even more depth than what you've already shared with us, which has been great?
Yeah, I learned most of my information from the Elevate Oral Care website. They have quite a few CE courses on the product. And so some of the newer ones coming out don't have a lot of of educational materials about their product. But, any company who makes it, they'll have something on there that you can watch and review and decide which one's going to be best for my practice. I think that that's a really great resource. And then I always just am watching like industry leaders on the product, like Jeremy Horsekeeper. He does a lot of research on silver diamine fluoride. So anytime he presents somewhere, I'm like, where are you presenting? I want to hear about your research. He's been involved in quite a bit of the studies and bringing it into America. So I always watch kind of the key opinion leaders who are chatting about it. And there's so much research and exciting research on it that has been done. So it's definitely something to dive into and see if it's right for your practice. And you might have to do some encouraging of some others in your practice to use it for some of those reasons that we talked about. But I just feel like as a patient, I want to know. I wouldn't ever want somebody to put a watch on me. Like I would, if you start to see an early cavity and you tell me just to brush and floss better, like we got to be doing more in dentistry. Like we got to be like, actually, we treat those now. And these are your options. We could do a one and done curodont. We could do a silver fluoride. Here's the pros and cons about both of those. And you can have your assistant place either of those, you know? So I definitely think it's a cost effective way to prevent and that it needs to be incorporated more.
We talk so much about the pay of dental hygienists and production and things like that. So I feel like this is a perfect way to bring it into a practice while also increasing production in a way that feels like prevention because it is. And it
Hmm.
just feels like it's totally aligned with all of the things that we do as hygienists. So I think it's awesome. And I
Agreed.
have to schedule a meeting with my doctor.
Agreed. I mean, like way quicker than a sealant, right? I feel like that was the first thing to go when I graduated was like a sealant on all adults, right? But this one, definitely time effective, cost effective. I feel like we could treat a few teeth before we dismiss that patient for the day. So super exciting and awesome technologies.
Well, thank you so much for sharing all of your information about SDF. I know that there is so much more that I could and will learn from you. I just appreciate you taking the time to be on the podcast again today.
You're welcome. Thanks.
All right, everybody, this is the Brush with Britt podcast.